What causes swelling of the legs and how to remove fluid from the body? Interesting about science and medicine, prepared by editors of the website netballoon.ru. In this article we have described 8 causes of edema. The first reason, edema is a build-up of fluid at the level of the thighs or legs. As a rule, leg edema does not present painful symptoms. The reasons may be varicose veins, pregnancy, or prolonged sitting on a chair. What can be done with edema? Raising the legs above the level of the heart stimulates blood circulation, eliminates swelling of the legs. Avoid sitting in a chair or standing on your feet for long periods of time. If the swelling of a leg does not disappear, you should consult a doctor. The second reason, premenstrual syndrome. In women, the following signs are noticed: insomnia, craving for certain foods, fatigue, anger, depression, irritability, anxiety, soreness at the level of the muscle and chest, headache, bloating. All this is due to fluctuation in the concentration of hormones. What can be done with premenstrual syndrome? Consult your doctor for the correct diagnosis. Eliminate the symptom depending on the manifestation. Take over-the-counter analgesic for pain. Limit salt intake. Intake of an increased volume of fluid. If the manifestation of a menstruation is severely weakened, the doctor may prescribe treatment. The third reason, kidney disease. The main signs of a kidney disease are swelling of the hand and feet, bad breath, pallor, weight loss, hypertension, frequent urination at night, constant fatigue. What can be done for kidney disease? Which side saying it's recommended to immediately consult a doctor. Kidney disorder put the patient's life at risk, requiring urgent medical attention. The fourth reason, congestive heart failure. Congestive heart failure is a disorder in which the heart cannot work at full capacity, causing fluid to accumulate in certain parts of the body. Signs of this disorder include shortness of breath on exertion, hypotension, low blood pressure, too fast and irregular heartbeat, swelling of the legs, hips and abdomen, couch, fatigue. What can be done for congestive heart failure? Ask a doctor for help. Possibly the doctor will appoint the patient hospitalization. Treatment may constitute such measures: special gymnastic, change in nutrition, surgical intervention, medication. The fifth reason, cirrhosis of the liver. Swelling can be a consequence of liver cirrhosis, which increases the volume of the legs. The main symptoms of a liver cirrhosis are yellow skin, itching skin, colorless faces, urine of dark color, abdominal pain, increasing abdominal and legs volume, nausea, fatigue. What can be done with liver cirrhosis? See your doctor immediately. Maybe the patient needs hospitalization to stabilize the disease. The patient should change his diet by following this recommendation to remove loading on the liver. Take a little medication as possible. Exclude alcohol. Limit salt intake. And the diet should consist of frequent but small meals. The sixth reason, acute renal failure. Symptoms include breathing problem, swelling of the legs and arms, rapid weight gain, headache, low volume urination or lack of urination. What can be done for acute kidney failure? See a doctor urgently. Using the right treatment can often restore kidney function. The main causes of acute renal failure are complications from another medical condition, anaphylactic shock, drug reaction, or infection. The seventh reason, varicose veins. Varicose veins of the lower extremities are characterized by following symptoms: blue swollen veins at the level of the legs, skin change such as peeling or ulceration, sometimes pain or tenderness of the legs, which often swell after standing. What can be done with varicose veins? Consult your doctor. The treatment of a disease depends on its severity. Your doctor may prescribe medications such as aspirin and ibuprofen to relieve pain. Attention! Aspirin is contraindicated for children and adolescents due to the risk of a Reye syndrome. The eighth reason, preeclampsia. Preeclampsia is a form of hypertension that occurs in 5 to 10% of a pregnant woman and usually occurs after the 20th week of a pregnancy. The main symptoms are swelling of the face and hands, stomach pain, sometimes irritability, confusion, blurred vision, headache, increasing body weight. What can be done? Seek medical help urgently. Mild cases are well treated with medication, which will increase the likelihood of having the baby on time, while more severe cases may require premature birth to save the life of a mother and her baby. That's all. Thank you for your attention. This material was prepared based on the material from website netbalesne.ru. This material is for informational purposes only. When observing various common symptoms, it is advisable to consult a doctor.